Hi everyone, my name is Madison Humphreys, and I'm going to be talking about the business plan for APR in women's health and med spa clinical practice. So, practice overview. The practice is intended to be an APRN-led, women-focused health and med spa clinic that fuses conventional clinical practice with aesthetic wellness care. It aims to design a place where women can obtain comprehensive, long-term, in various phases of life without resorting to several providers. The positioning of the clinic in Bowling Springs, North Carolina, will enable the practice to cater to an expanding community that has limited access to specialized healthcare services in the field of women's healthcare. The outpatient model also makes the service accessible, effective, and affordable, yet provides high-quality care. The practice takes care of the medical and personal well-being by incorporating preventative services, reproductive health care, and beauty treatment. This is an indication of a change in contemporary healthcare where consumers are increasingly focusing on the convenience, holistic medicine, and the relationship of trust between doctors and patients. Finally, the practice is designed to increase access, patient satisfaction, and long-term health outcomes in women. So, community and target population. Bowling Springs is a mixture of suburban and rural features with an uninterpreted population expansion thanks to the local development and the academic centers. Inadequate access to specialized women's health care therefore presents a common problem in such communities where patients who need such services have to commute a long distance in search of them. The purpose of this practice is to benefit a varied population such as adolescents, women of reproductive age, and older adults with menopausal and chronic illnesses. It also takes into account the need of college students and working professionals who need flexible and accessible care options. Its services are customized to promote preventative service, reproductive services, wellness, including aesthetic services that can be customized according to patients' preferences. The practice will ensure ease of access to care and continuing thereby enhancing patient outcomes. This practice is with the expectations in real world where patients expect convenience, trust, and holistic services all in one place. So the services offered. The services that will be provided are designed to bring a balance between the much needed clinical care and wellness and beauty treatments that have high demand. The main clinical services comprise women examination, screenings, and contraception management, as well as STI treatment and screening. These build a basis to sustain reproductive and preventative health. Management of menopausal is also targeted, including hormone replacement therapy that is poorly served in such a small community. On the med spa side, Botox, dermal fillers, and skin treatments introduce an extra value that satisfies the increasing patient needs for aesthetics. The use of hormonal and metabolic support is also a part of weight management and metabolic health management, and it has been identified that those two are interconnected. As practice has shown, these services together in a single practice not only enhance the convenience of patients but also enhance retention and continuity of care. This combined approach means that patients will be able to tackle both health and personal wellness objectives in one reliable clinical solution. So, services that are not offered. It is equally important to define what practice will not provide as well as define what services it is offered. This clinic will not offer OB services, pregnancies, and deliveries, as this type of care needs to be at a hospitalized facility and have constant care. Surgical gynecologists are also not applicable since they are associated with an increased risk and specialized services. This practice will exclude ER and urgent care services as the patients with acute care needs will need to be referred to ERs or urgent cares. The specialists to whom such high-risk pregnancies and complicated medical conditions would be referred are using means of referral to OBGYN physicians or care centers. In practical terms, having a clearly defined scope will safeguard both the patients and the provider since it will help avoid liability and provide safe and high-quality care. It also enables the practice to concentrate on its strengths, run smoothly, and establish good referral relations in the healthcare fraternity. Staffing, facility, and resources. The staffing model is strategically crafted to be efficient and promote quality care of patients. The APRN is the primary provider and the practice owner in charge of operating and clinical services. You will also have a registered nurse or licensed practical nurse will help in treating patients, and a medical assistant will facilitate the scope of work by rooming patients, taking vital signs, and helping in procedures. Front desk employees deal with scheduling, billing, and communication, which play a crucial role in ensuring the daily operations run smoothly. The position is involved to adhere to the North Carolina regulations, especially in prospective authority and clinical supervision. The facility comprises 2 examination rooms and 1 procedure room that is flexible when it comes to utilizing the facility in both medical and aesthetic procedures. An EMR system helps in documentation, billing, and continuity. Experience shows that the development of an appropriate team and systems at the outset avoids failure in the working process and contributes to continuous increase. Legal structure and collaboration. Its model of business organization is a professional limited liability company form that protects the APRN owner by providing them with the flexibility needed in doing business along with protection. Malpractice insurance comes into play because it assures the practitioner and the business against potential court actions. The practice is strictly in line with North Carolina APRN licenses, which outlines the scope of practice, prescriptive authority, and supervision. And this is all by the North Carolina Board of Nursing. It is legally necessary to sign a formal collaborative contract with the supervising physician, and it includes duty of chart review and clinical supervision. Besides the official arrangement, the practice will embody unofficial cooperation with the help of referral networks with the experts in the field of OBGYN, dermatologists, and primary care providers. Such collaborations will keep patients whose needs are more complex going through their care. It has demonstrated over time that the presence of both formal and informal arrangements fortifies clinical outcomes, patient trust, and builds on the credibility of the practice among the healthcare community. Funding and payment methods. This practice will be funded by a mix of personal investments and a loan with the Small Business Administration, which is a typical and viable measure for new healthcare companies. This will cater to the cost of setting up a facility, such as renting the facility, buying equipment, recruiting personnel, and the additional small business cost. The practice will also accept various payment methods such as Medicare, Medicaid, and large insurance companies like Blue Cross Blue Shield of North Carolina. Furthermore, cash pay plans will be provided when it comes to med spa services that parents usually do not cover. This leads to a hybridized revenue scheme that sustains financial stability. Experiences have shown that insurance reimbursement is not enough to drive growth because payments are lower. Large profit margins are achieved by incorporating aesthetic services, hence covering the operational cost. This golden mean will make it sustainable and will give flexibility as the practice expands and the patient demand changes. So this is reimbursement rates. So the effective reimbursement rate is a prerequisite in the assessment of the financial viability of the clinical practice. CPT code 99214 is utilizing this model as a yardstick for moderate complexity established patient visit. According to the latest Medicare fee schedule information, the service has a payment average range of about $125 to $130. The amount that is paid out in terms of Medicare is usually less, that is between $100 and $120, given the specific rates. Privately issued insurance is reimbursed with higher negotiated amounts and is typically at a higher rate, usually ranging between $100 and $50 to $170 at a visit like Blue Cross Blue Shield, North Carolina. Preventative services such as the Medicare wellness visit as G0438 costs about $100 and $50 to $170. On the contrary, aesthetic services are cash-based, and that Botox costs about a dozen dollars per unit, and dermal filler costs about $600 to $800 per syringe, which contribute to a balanced, sustainable revenue system. So, sample daily revenue. The daily revenue projection illustrates a realistic and balanced patient schedule for the practice. The estimated number of patients that visit the clinic is about 12 per day, and this takes into consideration efficiency and quality care. These visits are 6 insurance visits with an average payment of $160 per visit according to CPT 99214 and a combination of payers. This yields about $960 clinical revenue. The other 6 visits will include med spa services with an average revenue of $300 per patient and will make $1,800. When added, it makes the price per day about $2,756. This would translate to an approximate monthly salary of more than $54,000 in a normal 20-day work month. This hybrid model offers more financial stability with a predictable insurance revenue stream and increases margins in aesthetic services, thus is taking away dependence on any one revenue program. So we're going to go over salary, budget, and protocol. Based on patient traffic and total revenue improvement, the financial plan forecasts an annual salary amount of between $120,000 and $150,000 depending on patient traffic and annual improvement of the revenue. Monthly operational costs are about $28,000, which will cover important operational expenses, including rent, staffing material, insurance, and utilities. These are also budget provisions on repayment of loans and recurrent inventory costs, especially on aesthetic procedures utilizing in the med spa services. Through practices, it is essential to maintain high financial discipline at the start of practice to ensure sustainability and growth over time. Besides financial planning, the practice will be run on well-established clinical guidelines. These include standard treatment care, evidence-based practice, and accurate documentation procedures to ensure compliance and consistency. These protocols contribute to the reduction of legal risk, improving of the quality of care, and the provision of an efficient work process, which is a strong base on which the practice can be expanded. Outcomes and conclusion. The outcome evaluation is critical in maintaining the effectiveness, the efficiency, and the friendliness of the practice towards the patient. Survey and feedback tools will be used to gauge patient satisfaction. They will give a general impression and identify areas of improvement. Consistency clinical outcomes, including improvements in symptoms, treatment success rates will be monitored. The financial and operational performance will be assessed monthly to check the efficiency of our revenue and workflow. Moreover, the quarterly assessments will be performed with regards to the overall clinical quality and adherence to the protocols. The owner of this APRN will carry out these examinations, but with the assistance of the working physician to create a clinical supervision. Experiencing the practice that are able to measure performance regularly is more flexible and productive in the long run. In total, this model shows the sustainable and scalable solutions for women's healthcare that entails an excellent approach to clinical excellence and financial stability, and a focused presence on patient-centered care. And these are the references that are used throughout the PowerPoint.